So the last time I actually did a video on DKA overview in pediatrics, and I was sort of teaching with the whiteboard. I asked you guys for feedback, and that was like about 10 months ago. The channel had 5,000 subscribers, and I was hoping to actually reach 10,000 subscribers. But yet here we are with 14,000 subscribers. So I thought I would actually give you guys a very interesting video that I thought I may have overlooked when I was doing that lecture in the previous video. I will leave the lectures tagged at the end. I'll also leave them in the description so that you can watch all the DKA related videos so that you can have the best of both worlds. So this one here is a practical guide of how we can give insulin, especially in a setup where we don't have an infusion pump. Because remember, in patients that have DKA, you want to give it using an infusion pump. So grab a piece of paper, grab your pen, and let's go. Hello and welcome to MK's Medical Review Series. My name is Dr. Moses Kazevu. This is a series on my YouTube channel where we look at medical topics in depth. In this particular video, we're going to be looking at a practical guide in terms of insulin administration in DKA. I already talked about the principles of DKA, so if you still do not know that, I will leave them tagged at the end of this video. I will also leave them in the description where you can head over and check out those videos that I did on DKA. So I won't spend so much time explaining about DKA. So remember that when it comes to the management of DKA, largely, let me just get my pen here so that I can teach you guys using the pen. So largely, it's going to be based on a mnemonic that we discovered that was known as FIPA. So remember, you can either use the mnemonic FIPA or you can use the mnemonic SIPA. Now, F is pretty much going to be standing for fluids. We discussed in details in the previous video. I is for insulin, which I talked about, but I realized that I actually didn't mention how you're going to be giving this insulin. The P is for potassium, which I talked about, and the A is for antibiotics. The S is just simply stands for solutions. So I just want to focus a little bit about the insulin that we're going to be giving, especially in these patients that have DKA. I'm focusing very much on the ones that are coming in and they're unconscious, not the ones that are awake and you can actually even give them subcutaneous insulin. No, I'm focusing on those that come in with DKA, they're in a bad condition and you want to give it IV. So remember, number one, the first type, what's the type of insulin that we're going to be giving these patients? Now remember that here we're going to be giving these patients the soluble insulin, the short-acting insulin. And what is going to be the route of administration that we're going to be giving these patients? In this case, remember that this person that has DKA has severe dehydration or they may be in shock. So most of the blood is being shunted away even from the skin. Most of the blood is being shunted away from the subcutaneous tissue. So it means that even if you were to give them as a subcutaneous injection, you wouldn't actually do much because that insulin won't get absorbed effectively as opposed to you giving it directly intravenously. Now, the problem that you have with giving it directly intravenously is that you have to give it in a controlled manner because you want the sugars to be dropping at a certain rate. You don't want to fuse in a lot of insulin at once because that may end up killing the patients because the sugars will drop very quickly. They'll cause these rapid shifts of fluid between the cells and the interstitial space, and then this may cause even more problems for this child. Things like cerebral edema that may ensue later on, especially if you're giving the fluids non-judiciously, if there's such a thing. So remember that the route of administration of these that are coming in with DKA and are unconscious is predominantly going to be given as IV. So this is going to be an IV infusion. If you have an infusion pump, it's very easy to do because you can just simply enter the amount of volume that you have of the fluid. You can enter the rate that you want it to run at, and you can pretty much set it, and then it gives you an alarm when it's not running. It gives you an alarm when it's done. So it's much more easy when you have an infusion pump to pump in this insulin. But in most of our facilities here, and even in most third world countries, you're not going to be having that infusion pump. So you need to know how to administer this insulin. So first of all, before we go into the administration of insulin, we need to calculate the dose. So you need to know what the dose that you're going to be giving. So the dose of the insulin. And in this case, in terms of DKA, remember that we're going to be giving 0.1 international units per kg per hour. Remember, this is going to be the dose that you're going to be giving. So every hour, this child must be receiving 0.1 international units per kg per hour. And once our RBS drops to less than 12, there are people that use different thresholds. There are some people that use 14 as a threshold. You're going to half the dose. So once now this RBS is less than 12 millimoles per liter, you're going to half the dose and you're going to be giving them 0.05 international units per kg per hour. So it means that you're going to be giving them half the dose because you don't want to tip them into hypoglycemia. Now, let's do the actual calculation and see how exactly we're going to be giving this insulin. Now, I'll give you an example, and I will say maybe perhaps we have a child that has come in and they are weighing 30 kg. And this child that is weighing 30 kg has DKA, and this child is unconscious. Now, remember that the very fact that this child is unconscious and they're having DKA, obviously you're going to start to run the fluids. And one thing is that it's very important to run the fluids at least 1 hour before you actually institute the insulin. There's a big reason for this, because if they're in shock, even the distribution of the blood to the GIT, distribution of blood to other systems may not be as effective. So you want to first start to correct the fluid imbalance before you can actually start to give them the insulin. And moreover, when you give them the fluids, it also helps with dropping the blood sugars before you even initiate the insulin. Now remember that we say that this was going to be a dose of 0.1 international units per kg per hour. So how much insulin is this person supposed to be receiving each and every hour if we actually calculate this? So we're going to say they're going to be receiving 0.1 multiplied by 30 kilograms, and then this is going to give you 3 international units per hour. So it means in 1 hour, this person must be receiving 3 international units. Now remember, when their blood glucose now falls and it's actually less than 12 millimoles, then we're going to half the dose. So instead of us giving 0.1, we're going to be giving 0.05 international units per kg per hour. So if we calculate this and see how much insulin this patient is actually going to be receiving, we're going to say 0.05 multiplied by 30. So if you multiply 30 by 0.05, so that gives us roughly around 1.5. So it means that once the blood sugars have actually fallen to below 12, you're not just only going to change the amount of fluid or the type of fluid that you're giving to maybe something like a DNS, you're also going to be changing the dosage of the insulin, because you don't want to keep the blood glucose rapidly falling. The patient may become hypoglycemic, and in you trying to solve one issue, you may end up killing the patient with another issue. Okay, so well and good. Then what? What are we going to do? We have this 3 international units per hour. What are we going to do with it? We don't have an infusion pump. The insulin that we have comes in a vial. What next? What are we going to do? So this is where I wanted it to be as practical as possible. Now, you can make a solution that you're going to be giving this child over a certain period of time. Remember, when we were calculating the fluids, we said that we're going to divide the fluids into aliquots of 3 aliquots per 24 hours. So it means we're going to be giving the fluid 8 hourly. Coincidentally, you can also decide to give the insulin infusion continuously over 8 hours. So you can give it 8 hourly. So it means if this person is receiving 3 international units per hour, how many should they receive in 8 hours? So in 8 hours, we're going to say 3 multiplied by 8. So that's going to be roughly about 24 international units in 8 hours. So over 8 hours, they must receive 24 international units initially. But you're not going to get this 24 international units and just put it as a bolus, because you drop the sugars very quickly. The child may actually even die. So what we're going to do is that we're going to get 50 mils of soluble insulin. Okay, you can get any amount that you want, but get 50 mils of soluble insulin. So this is 50 mils of soluble insulin. And what we're going to do is we're going to add it to 50 mils of normal saline or normal saline. So once you have added the 50 international units, rather, not meals. This should be 50 international units. 50 international units, you have added it to 50 mils of normal saline. So it means in 50 mils of normal saline, you are having 50 international units. So in essence, if we divide both sides by 50, we divide this side by 50. So it means the concentration of the solution that you have created is 1 mil of normal saline is going to be giving you 5, or rather 1, not 5, because 50 divided by 50 is 1 international unit of insulin. But then now this 1 international unit of insulin that you're giving, you need 3 international units per hour. It means that in about 1 hour, you just need to give 3 mils. How are you going to give that 3 mils in 1 hour? It's a bit of a challenge. So now this is where now we get to this particular 8-hour regimen. So this 8 hours, we're going to be giving the insulin as an infusion over 8 hours. So it means this same 50 mils that you have created, you want 24 international units to go in 8 hours. So if 1 mil is going to be equal to 1 international units, 24 international units that you need to give in 8 hours is going to be equals to how many mils? So this is going to be equals to, let's say, x. If we multiply x by 1, 24 by 1, so x is going to be 24 mils. So this means that you're going to be giving this 24 mils, or half of this solution must be given over 8 hours. So this half must be given over 8 hours. I will show you how exactly we're going to now be calculating how many drops we're going to be letting this run, because this is now 24 mils. So 24 mils must be running over 8 hours. And once you run that 24 mils over 8 hours, if you divide that by 3, it means every hour you are giving this person effectively 3 international units per hour. Now, it's not like you're just going to connect this insulin and go away and not check this person's blood sugars. You'll be checking the blood sugars every hour. And once you're checking the blood sugars every hour, you can either adjust by increasing the rate or reducing the rate, so that you can either regulate the drop of the glucose so that the blood sugar doesn't drop very quickly. So I hope this makes sense. I'll run it through once more. So we had a 30 kg child that came in with DKA, and this child was unconscious. So remember, when they come in with DKA, you have fluids which are already given, and we want to aim to give the fluids over 8 hours. We have the insulin that we should start. And remember, the insulin should be started 1 hour after you've instituted the fluids. It's going to be started at a dosage of 0.1 international units per kg per hour. Then once the blood sugar is less than 12, we're going to now reduce it to half the dose, 0.05 international units per kg per hour. So suppose this child that's weighing 30 kg, we're going to say 0.1 multiplied by 30, so they should receive 3 international units per hour. It's very difficult to give this 3 international units per hour, especially if you do not have an infusion pump. So what are you going to do? We're going to aim to give it 8 hourly as a continuous infusion. So if in 1 hour you're giving 3 international units, in 8 hours you should multiply 8 multiplied by 3. So it means you should give 24 international units over 8 hours. Now, how are we going to give this 24 international units? Because it's not possible for you to give 3 meals to an individual over 1 hour. How are you going to give it and stretch it over 1 hour? So what we simply do is we get 50 international units. And this 50 international units of soluble insulin, we add it to about 50 mils of normal saline. It depends on whatever you want. You can get 80 international units added to 80 mils. You can get 100 international units added to 100 mils. But whatever concentration you should make, you should aim to make a concentration where 1 mil is going to be equal to 1 international unit. So if we add 50 international units to 50 mils of normal saline, so it means that once we reduce that calculation, 1 mil of normal saline is going to be equal to 1 international unit of insulin. But we need 24 international units over 8 hours. So it means we need 24 mils. So in 8 hours, this child must receive 24 mils. So the order that you give is give 24 mils over 8 hours. Now, the question that most of you are going to ask, how am I going to set the drops on the giving set that we have when you're connecting this to this baby? So there is what is known as calculation of the IV drip rate, which is quite important for you to know. So this is now the example that I was talking about. So here, there are a few things that I want us to establish. So from our previous case, we already established that we had a 30 kg child. And this 30 kg child required 24 international units of insulin over 8 hours. And this 24 international units over 8 hours is translating to our 24 mils of that solution that we created, where we got 50 international units of insulin and we added it to 50 mils of normal saline. So they need to give this normal saline over 8 hours. You need to give 24 mils. So how many drops per minute is this going to run? So there are a few things that you need to know. First of all, the calculation of your volume is supposed to be in mils, so this is already okay. The fact that it is in mils, it's okay. If it was in liters, if it was, for example, 2.4 liters, you would convert that to mils by multiplying by 1,000. You multiply that by 1,000 if you're changing from liters to mils. But the very fact that it's already in mils, no problem. This, which is in hours, needs to be changed to minutes. So we change this 8 hours that we're going to be given this fluid. So if we say 8 multiplied by 60 to see how many minutes do we have in 8 hours. So 8 multiplied by 60 is going to give us 480 minutes. So this is going to be roughly in 480 minutes. This is very important because it's going to help us calculate how many drops per minute should we let this drip run so that we can deliver 24 mils into this child's bloodstream. So there is a formula that is needed. The formula is going to be as follows. So the drip rate is going to be equal to the volume of fluid that you want to give in mils divided by the time in minutes multiplied by the drop factor. Now, what do I mean by the drop factor? The drop factor is just simply how many drops per mil can your giving set give. If you read them very closely, there are some which are known as macro drip giving sets, which are going to be delivering about 10 to 20 drops per mil. The ones that you may find in pediatrics are the micro drips, which are going to be given this precise drops per minute. So they can even give you 60 drops for you to actually make 1 mil. So these are the ones that we often find in pediatrics. So I'll do the calculations with the one that has 60 drops per mil and the one that has 20 drops per mil. So how many drops per minute? So drops per minute, DPM. How many drops per minute do we have? So we're going to want to give a volume of 24 mils that we're going to be giving, and this is supposed to be given over 8 hours. So this is going to be divided by 480. Then all this is multiplied by the drip rate. So in this case, we're going to be multiplying it by 60 because our giving sets are going to be giving 60 drops to make 1 mil. So if we divide 24 divided by 480, so this is going to give us 0.05. Then this multiplied by 60, this is going to give us 3. So it means every minute this infusion rate must be running at 3 drops per minute for you to actually make sure that you give this person this 24 mils over 8 hours. You're going to be setting it to run at 3 drops per minute. If this was one that is giving you 20 drops per mil, so you would multiply your 0.05 multiplied by 20, meaning that you would let it run at 1 drop per minute. So only 1 drop per minute. That's very, very slow and very difficult to do with, especially those macro drips. This calculation is much easier, especially if you have a much larger volume, and it will be much more reasonable to do. But of course, in pediatrics, the very fact that you have these micro drip sets, you can actually work this out. So I'll give you another example of a child that's weighing, or a person that's weighing significantly more. So let's say this person here is weighing, for example, 60 kg, for example, 60 kg for some reason. They're weighing 60 kg and they come in and they're in DKA. Remember, if they're in DKA, it means that they're going to be requiring a fluid, rather an insulin dose of 0.1 multiplied by 60. So they're going to require about 6 international units per hour. So in 8 hours, it means that this person is going to require 6 multiplied by 8, about 48 international units. So this will translate to about 48 mils. Remember, if you take your 50 international units and add them to 50 mils of normal saline, where you create a solution that's giving you 1 mil is equals to 1 international unit. So here now you're going to have the 48 mils of that fluid that needs to be given over 8 hours. So again, how are you going to calculate our drops per minute? We're going to say 48 divided by 480, which is the time that we're going to be giving it, the volume that we have divided by the time in the minutes multiplied by the drip rate. So suppose here we have these ones that are giving 20 drops to give you 1 mil. So if you do the calculation here, 48 divided by 480, that's going to give us 0.1 multiplied by 20. So that will be about 2 drops per minute if you are using the macro giving sets. If you're using the micro giving sets, it's going to be again 48 divided by 480, and you multiply that by 60. So you're going to be giving about 6 drops per minute if you're using these micro drips. I really hope that made a lot of sense and was a bit more practical in terms of how you're going to be administering the insulin in our setup. If you did enjoy this lecture, consider subscribing to the channel, hit the bell notification icon to be receiving notifications of such amazing content every time I post. To Zambia and beyond, my name is Dr. Moses Kazevu. Until next time, bye-bye.